So services that are currently resuming in Arizona. Effective May 1st, elective surgeries from authorized hospitals and outpatient surgical centers resume with elective surgeries if they can demonstrate adequate capacity. We've had 1,100 folks that have opened on May 1st. Retail shopping on Monday, May 4th, limited opening through appointments, curbside pickup and delivery, and on Friday, May 8th, will be a full reopening with strict physical distancing and CDC guidelines. Now, many of you are already inside retail establishments like grocery stores and Costco's, etc., with responsible behavior and physical distancing. This is what you can expect as the remainder of retail establishments reopen on Friday. Next, barbers and salons. On Friday, May 8th, barbers and salons may reopen. There will be public health protections, CDC guidelines that are available at azcentral.com. There will be reduced capacity and occupancy, enhanced sanitation protocols, masks, physical distancing, and depending on occupancy level, business by appointment. We talked about last week an aspirational date around dine-in services. Today, I'm able to give a date certain of Monday, May 11th. Dine-in services can reopen. There will be physical distancing inside these establishments. We're working closely with the industry, and they will have this week to prepare, and there will be more to follow on this, but I want the restaurant industry to know that this is what's going to happen next week. We've been in conversations for several weeks. This is a safe and good option at this time, and they'll have a full week in which to prepare. What's next? We're working with the fitness industry. So there will be more to follow here. If you'll recall, the fitness industry closed by and large voluntarily before some of the announcements that we've made. We've got some discussions that we need to finalize with them. We want to work with the fitness industry along with our hotels and motels and our apartments on what the proper guidance is around gyms and pools, of course informed by the CDC. Long-term care facility, our goal is we want to test everyone inside our long-term care facilities. We're going to increase the testing and prioritize our vulnerable population and staff within congregate settings. We are moving to where our largest concern is in these congregate settings. We want to enhance infection control recommendations for these facilities. So along with the long-term care facilities, we'll be focusing on the Arizona Department of Corrections, recidivism, and reentry with additional supplies, swabs, reagents, rapid testing machines. We're going to expand testing for inmates and correctional officers alike. Also, long-term care facility notification. There were some questions about this at the last press conference. If you have someone who is a loved one inside a long-term care facility, as I do, if they were to contract COVID-19, you would be contacted immediately. If someone who is not your loved one contracts COVID-19 in that same long-term care facility, you would be contacted immediately. If you would choose to remove your loved one from that long-term care facility and you would want to take them to another long-term care facility and they were approved as a patient, you would be notified immediately on the COVID-19 circumstances for that long-term care facility.